Hi everybody, Kate here, one of our physical therapists from our East Norristown location, here to go over and teach you guys how to use a blood pressure cuff to assess and train your trunk and your core muscles. Okay, so low back pain, hip pain, those are two of the biggest diagnosis complaints that we hear in here, and very often it's because your trunk and your core are not working well together with your lower half. So the blood pressure cuff underneath your back is a great way to sort of tell how much your back is compensating when you're using your legs. Okay, so what's going to happen is the blood pressure cuff is going to go underneath your back as you're laying on a table, laying on the floor. And what you're going to be watching for is this needle. Okay, so I'm going to teach you how to set it up, but what you're going to watch for, this needle here, okay? You guys are going to pump it up between 50 and 60 here. Okay, that's step one. So why don't you get your blood pressure cuff, hit pause, and go get yourself set up so we can go through the rest of this video together. Because the next step is to get the blood pressure cuff on the table, on the floor, and you're going to lay on it. It's going to go just above your tailbone. Okay? And I usually have these pieces sticking out on this side. I'm right-handed, so that makes the coordination a little bit easier. So I'm going to lay on it. All right, get comfy. And what I'm going to do, so step one, it's just above my tailbone, and I'm going to pump it up. Pump, pump, pump. So it's at about 50 to 60, okay? And you're going to feel the air and the pressure underneath your low back, okay? So what you can do is sort of play around with this right now. So it's important for you to understand what it means when the needle goes up and what it means when the needle goes down. So right now I want you to try and press your back down into the table. So you're taking your back and pressing it down into the table. And what you're going to notice is that needle goes way, 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 way up. Okay, so if I press down, that means the needle is going up. Now, I want you to do the opposite. So now I want you to sort of arch your back up and off this way. And then watch the needle. Same thing, you'll watch the needle, but this time you'll notice that the needle goes down. Okay, so it's important for you to understand if the needle goes up, that means you're pressing your back down into the table. If the needle goes down, that means you're arching up and off of the table, okay? Now, once you understand that, next step, activating your transverse abdominis. Your transverse abdominis is cued, how we cue that in the clinic is pulling your belly button in towards your spine. So you're sort of sucking your belly in a little bit. It's a gentle movement, and as you're doing that, watch the needle. It's so gentle that as you activate that muscle, activate and relax, that needle should not really move at all, okay? It's common that people who are activating their transverse abdominis want to push their back down into the table. You are activating so many other muscles in your hip and in your low back to do that. Way too much. So use the needle to gently activate belly button to spine, and then as soon as you start to see that needle jump up, that means you're activating other things. So with the transverse abdominis, the belly button to spine movement, less is more. Okay, this is a very, very gentle movement. So belly button to spine. So I'll have patients practice this 10, 20 times. You're just practicing, I'm pulling my belly button in towards my spine, and I'm relaxing, and that needle is not moving. Okay, it might take a little bit of practice, but that's why we're using this. Okay, so once you kind of get the hang of that, just engaging your transverse abdominis, which is a huge stabilizer of our trunk, our low back, and our sort of core region. And you can add some leg movements. So again, the ultimate purpose of this is to really try and train your legs to move off of your trunk, which is the stable base. Your trunk should not be participating and assisting in moving the legs. Okay, so what we start with is belly button to spine, activating, and what I'm going to start with is a little march. So I'm going to lift one knee up at a time. I'm going to alternate. Okay? Watch the needle. With this particular exercise, it's common that people want to push down into the table to help lift their legs. So you're going to see that needle go up. You're trying to limit that. The needle should not really move. For beginners, I usually say give yourself a little bit of air. So if that needle's at 50, you can let it go up to 60. but no more. And if you're going up too much, then you don't have to lift that leg up as high as you can. It can just be a little lift, an inch or so off of the floor, okay? And then you practice that. You practice that and really trying to maintain my transverse abdominis, belly button to spine, and my trunk in a neutral position as I lift, okay? So that's the first one, the march. I'll have patients do like a set of 5 of that. You don't want to keep going, keep trying. You'll fatigue, and then you get mad, and then you want to throw the blood pressure cuff in the trash can. So you want to try and keep it limited, okay? So 5 reps. Next one, bent knee fall out. So your knees stay bent, your feet stay flat on the table, on the floor. Activating my transverse abdominis, and I'm going to drop one knee out at a time. So my knee is dropping out this way, and then I'm bringing it back up. And then same thing on the other side. Okay? And same thing, I'll do 5 of these, monitoring what's going on the needle and adjusting accordingly. The last one, heel slide. So with this one, all I'm doing is straightening my knee out, sliding that heel down, sliding that heel back up. Okay? So all of these exercises challenge the trunk in different ways and can be challenging in different ways. So the important thing with all of this is just really trying to be mindful of maintaining that belly button to spine moment, okay? If you have any questions, if you do have the the thought to chuck this in the trash can because it's too frustrating and you can't do it and something's wrong, come on in, let me help you, okay? There's a couple of tricks to this that we didn't go over, and will probably help you perform it better. All right, good luck.